Danyahl Robison is joining us today on this episode of Voices of Veterinary Medicine, and she is a CVT extraordinaire. And CVT, if you don't know, stands for Certified Veterinary Technician. And we're going to talk about a little bit about her past, as well as when we first met, which was when I was a baby veterinarian starting my career in the ER. So hopefully she's going to give us her perspective on my performance as a baby vet. And I've told her to please be honest. And I think she knows me not to be a vengeful person. So hopefully she will. Welcome to the show, Danyahl.
Thank you. I'm glad to be here.
So tell me about how you ended up making the decision that you wanted to go into veterinary medicine. Tell me about when it first started. Was it your childhood?
Yeah, I mean, I've always had a special, niche, I guess you could say, for working with animals ever since I was little. Started out volunteering at animal shelters, and then my mom started up a wildlife rehabilitation and exotic rescue, and I just took that on. And so that was the start.
And how old were you when your mom started the wildlife rehab?
I was about 10 years old. So I was raising baby raccoons and squirrels and bunnies and birds at 10.
Wow. That must have been so exciting for you as a little girl.
It was definitely taught me responsibility, and was definitely a huge stepping stone in where I'm at right now.
And then you also mentioned in a previous conversation that you ended up working at shelters, and then you ended up on the founding board of one of the shelters when you were really quite young. Was it 10?
That was probably when I was about 14 years old, that a bunch of us animal lovers that had worked at or volunteered at different shelters throughout the McHenry County area kind of collaborated on what we all thought would be the ideal shelter, and so we started up Animal Outreach Society, and it was a foster home-based shelter that dealt with cats only, which there weren't too many of those in the area. So that was
kind of filling a need.
Yes.
Yeah. Okay. Wow. So, and you were, what kind of work did you do as a founding member? Was it organizational? And
yeah, it was organizational. At the beginning, we were all just trying to figure out policies and procedures and figure out our logo and our name. You wouldn't think that would be so hard, but figuring out your name and your logo is some of the hardest things ever. And then once we got that kind of figured out, then we started delegating roles as to how to run the shelter. And mine and my mom's part was the intake as well as the adoption. So we would go to PetSmart, and we would have our little table set up there with our kittens and cats that were ready for adoption, and have people go through our adoption contract and kind of figure out who would be the best fit for each little kiddo. Wow.
And this what year was this approximately?
Oh my goodness. You're making me think. I was probably 15, so that would be 17 years ago. Now y'all know how old I am. So about 2000?
Okay, 2000. All right. So at that time, the internet existed, but it wasn't the big thing that it is now. It wasn't like part of everybody's life and you couldn't live without it, exactly. Right?
Yeah, so a lot of ours was by word of mouth, as well as being at PetSmart and Petco's on the weekends, and just kind of getting our name out there.
So you actually had to approach these corporations and ask permission to set up an adoption table.
Yeah, our president actually was in charge of all of that. There was a lot of paperwork and details that went into that. They had to, look at our policies and procedures, our adoption contracts. A lot of times they want to inspect the facility, but we really didn't have a home-based facility. So they just kind of talked to a bunch of our main foster people, and then they allowed us in. So it was kind of fun.
Wow. Yeah, I can imagine that there would have been a lot of red tape for that, because those big corporations, they have to cover all their bases, I'm sure.
Yeah.
That's great. And my understanding is that this outreach, what was it called again? I'm sorry.
Animal Outreach Society.
Animal Outreach Society is still going. Yeah. So
up and going.
That must be very satisfying.
Yeah. It really is.
Just other people took up the mantle and carried on. That's wonderful. And so when you were this age and you were working with shelters, and is that when you decided that you wanted to go into veterinary medicine?
I had actually always kind of, according to my mom, always wanted to be a veterinarian. Like, when you ask your kid, what do you want to be when you grow up? My response is always, I want to be a veterinarian. I want to be a veterinarian. I want to be a veterinarian. And it never changed as I was growing up and as I was filling out applications for college. And it had always been that goal, that dream.
Right. What did you think it would be like to be a veterinarian? What was your vision?
My vision at the time was just, getting to help out animals and, make them feel better. I really wanted to go into more of the exotic side of things and work at a zoo. I had worked at different day practices while I was growing up, so I kind of got a glimpse into it, but not a full vision into it, because at that point I was still just a kennel kid taking care of the boarding dogs and cleaning the hospital when everyone left. So I didn't get to see the full spectrum of it entirely.
Yeah. It's amazing how you can work at an animal hospital. Like when I was getting my hours for vet school and I worked as an assistant, it's amazing how you can work at an animal hospital and still have no idea what it's really like when, to be the person in charge. So, okay. And then, so you ended up at Colorado State University. You were working on getting your prerequisites for veterinary school. So you were on track to follow through with your original vision. And then what happened?
Finances. Vet school is very expensive, as everyone knows. And I was trying to have a go at it kind of by myself. And after taking out a couple loans on my own, my debt to income ratio was undesirable for getting a loan. And so I actually had to stop after my fall semester of my third year in. That was quite saddening. I was lost for quite a while trying to figure out what I was going to do.
And at that point you had, so vet school is very expensive. Everybody knows that now, but a lot of undergraduate programs are expensive as well, depending on where you go. So, and at that point, my understanding is that you had quite a bit of student loan debt already.
Yep. I had close to $80,000 between my tuition and books and that kind of stuff.
Why did you decide to go to Colorado State? Because you were originally from Illinois.
Colorado State at the time when I was applying was one of the top veterinary schools to go to, as well as it had an excellent exotics section.
I see.
So that was why that was my main focus. I think it was in the top top 5 or top 10 vet schools to go to in the country. And when I got accepted, I was like, oh my Lord, how awesome is that? And
so you thought that if you went to Colorado State for your undergraduate, that might increase your chances of getting into the veterinary school there.
Yeah, because unfortunately, getting into the veterinary school, if you are not a resident there, there are very, very, very few spots available for out-of-state applicants. And Illinois, unfortunately, is not one of their sistered in states. And so my hope was that proving myself academically through my undergrad, that would get me kind of a foot forward in the application process.
Plus you'd be in state. Right.
Well, not necessarily. You actually, I found out afterwards, have to live there for a year, not going to school, working, paying taxes, and then you can consider yourself an in-state student. So I was actually, during my entire undergrad, paying out-of-state tuition.
Yes. And that's really interesting because I know, it's part of many people's strategies when they start thinking about where they want to go to veterinary school. And most veterinary schools have, in-state tuition, which is cheaper versus out-of-state. Plus, you have a greater chance of actually getting in if you're a resident of that state. However, and I'm really glad you brought that up, you have to be really careful because each state has different rules as to how residency might be established. Some of them, are okay with you going to undergraduate and then they consider you an in-state student just from that. But some of them, like you said, like Colorado in this case, you actually have to not be a student, just live there, work there for a year before you can apply and get your in-state tuition. Yeah, so that's something that's really important to pay attention to for other people who are interested in doing that and following that strategy. Okay. And so then after you decided that you couldn't go on because it was just going to be too expensive, and you said you were lost, what did you do?
There was like a couple month, almost like grieving period, because I was basically watching my whole entire life's dreams like spiral down the drain and wasted thousands upon thousands of dollars. And it wasn't until I saw a TV ad of all things for Bel-Ray Vet Tech Institute that was in Denver that I was like, well, maybe. I don't know, could be fun. And so I requested some information. I spoke with them and I had informed them because through them at that time, it was about $18,000 to go. And I told them, I was like, well, this is my situation from Colorado State. I was going to do my undergrad and go to pre-vet school and I can't get loans. I can't get a personal loan, and the federal loans are never big enough to cover my tuition. Well, they informed me that if my parents applied for the Parent Plus loan and got denied, the government then had to increase all of my federal loans to cover my tuition. Now, had I known that while I was going to CSU, had the financial aid department there explained that part to me, because they kept on telling me, oh, have your parents apply, but they never took it that step further and told me why. I'd actually probably be graduated from vet school right now, which is kind of hindsight, sucks, but I'm happy.
You also have about $350,000 in student loan debt.
Yeah, exactly. So they worked with me. I got scholarships through them and ended up going through their 2-year program at Bel-Ray Institute in Denver. And then working at quite possibly the coolest place in the universe, Alameda East Veterinary Hospital, which was quite unexpected and was kind of that cherry on top of the sundae, this is going to work out, this is the path that you're supposed to be taking, kind of like glimmer of hope for me when I got,
Right. Let's go back, if you don't mind, just for a moment, because I want to clarify, because I remember when I was doing my undergraduate work to qualify for vet school, and it's very different, the kind of loans that you get as an undergraduate versus a professional student in like medical school or veterinary school, because undergraduate loans, they're limited to a certain amount, and then they, you might not be able to actually pay your living expenses with them, I think.
Yeah. The federal loans were more so, if I remember correctly, now this is a while back since I had to go through all of this, but the federal loans were more so specifically for your tuition. Tuition,
right.
Personal loans for anything above and beyond that.
Right. And you couldn't get personal loans.
Correct. Yeah. Right. I had already taken out a significant amount in personal loans to compensate the difference between what I was getting in federal loans for the first 2.5 years that I was going there.
Right. So. And were you working at the same time as well?
Yep. I was a full-time student and working full-time. I actually worked at the Colorado State Pathology Department on their chronic wasting disease project. So.
That's super exciting. That would have been really great on your vet school application.
Yep.
Yeah. So I remember having that worry when I was an undergraduate student, like, because you cannot work when you're a veterinary student. I mean, you're literally in class, from 8 in to 5 p.m. and studying the rest of the time. And versus undergraduate, a lot of people have jobs, maybe not full-time jobs, but there's time enough to have a job and still get your classes. But so I was worried about that. But then it turns out that when you go to veterinary school, the loans that you're given are actually designed to not only pay your tuition, but also to pay your living expenses.
Okay.
So, yeah, which is another reason why you end up so indebted. But okay, so then let me ask you about vet tech school, Bel-Ray Institute. Tell me a little bit about it. Like it's a 2-year program, correct? Okay.
Yeah, they do quarters instead of semesters. So it's typically 10 weeks on, 2 weeks off, 10 weeks on, 2 weeks off. And then around Christmas time, you get a 4-week break. I was able to transfer in a bunch of my, lower level classes, speech, English, math. So I didn't have to take those. But we took, anatomy and physiology, 2 quarters of that with coinciding labs. We did an entire quarter on hematology, on microbiology, radiology, pharmacology. There's also large animal, husbandry, exotics. So they kind of put us through just about everything and anything you could think of to learn.
Yeah. And did you enjoy it?
Oh, I loved it.
Happy time? You loved it.
I loved every moment of it. Class sizes were smaller. There was more one-on-one time. Like any type of education, you kind of get out of it what you put into it. And I was, one of those overachiever, straight A students, had to have that 4.0 GPA. So I absorbed everything that they threw at me like a sponge.
And what about your classmates? Did you find that all of them were like you, or?
A good portion of them were, but there were still those few that went into it thinking it's all about the puppies and the kittens and you don't have to deal with people. And, that mentality of, well, C's get degrees and it's at least something to do with my life. Mm-hmm. In the animal world, you kind of have to have your heart into it as well as your mind, because if you don't have a passion for it, it is going to run you over like a freight train. You're gonna get burned out. It's a lot harder if you don't have that passion for it.
Now, I've been wondering about this, because I know about, and anybody who works in the field of veterinary medicine knows about the high rates of burnout and compassion fatigue and depression and all that. And I've been wondering if our passion for this career isn't part of what makes us vulnerable, to care so much.
Yeah.
So I'm just wondering, like, the people who didn't care as much as you did, you said you think that might burn you out, but what do you think about the idea that maybe caring as much as we do can be dangerous to our mental health as well?
I definitely think that is a proponent in where we deal with compassion fatigue. For the people who kind of don't have the passion for it, the drive to do it, I think, they do burn out, but it's more so from not being able to do the job appropriately and getting, repercussions from it. And
I see.
That always makes it hard as well. If your boss is always like, "Hey, this needed to be done this way. Hey, that's not right."
I see.
Like, well, why did I even do this? So you definitely have to have a drive and a motivation to be in this world of animal medicine.
So you're talking about if you don't have the drive and the passion to be good at your job, to continue learning, that's what's going to get like those people in trouble later. Yeah.
They kind of get stagnant, and
yeah,
some clinics are okay with stagnant technicians that just come in, do their job and leave. But in this profession, you have to be forward thinking. You have to be willing to expand your horizons, learn new ways. They call it practicing medicine for a reason, because we're all practicing to get better.
Right.
If you're not willing to get better, you're going to get left behind.
Right. Yeah. And I think that you and I have both encountered technicians like that who just didn't have the right mindset to really succeed as technicians. And it's frustrating for them, but it's also frustrating for everybody else who depends on them, and they're not able to do as good a job, and they're not as dedicated to improving. Yeah, unlike you. So then let me just clarify. So you did a 2-year program at Bel-Ray, but there was also a 3-year program because they had the core classes. So some people had to do the 3-year, but you could do the 2-year because of the classes that you'd taken at CSU. Yeah,
it was not necessarily a full 3-year. It was more like a 2.5-year kind of program. They also had a fast track 18-month program, but with that, you were taking 5 to 6 courses every quarter, and I wanted to be able to focus and learn as much as I could from those courses. And so I had on average between 3 to 4 lectures a quarter, which was perfect because I didn't get overwhelmed, and I was able to, like I said, focus on those classes and learn everything that I possibly could from them.
Right. Actually absorb it versus cramming it. cram and dump. Yes. To make room for the next course. Okay. So, and it was $18,000 for your veterinary technician degree, and you don't actually, so you don't have to have college credits or a college degree to go to veterinary technician school.
No, you can go straight from high school.
Okay. And then you end up with 18, is that the average now for veterinary technician school, 18,000 or?
I think right now, because that was back in 2006, so almost 11 years ago when I started going.
Okay.
I think the average some of the colleges out here charge, $36,000 for this associate's degree. And you really need to be, I guess, looking into the programs and actually seeing how they're teaching and have a certain standard for how you want to learn. And, balance with what you're paying for this schooling. Because not always is the highest paying school or the most expensive school the best one.
Right. How would you go about knowing? Because I know that there's fewer now, and a lot of veterinary technician schools have had to shut down because they weren't able to demonstrate that their students were being able to go on to gainful employment. That was the Obama law about federal funding for those schools, and they couldn't prove that their students could get employed after finishing their program. So a lot of them shut down. But my understanding is there's a huge variability in terms of the quality of education offered by these different vet tech programs. So how would you know whether it was a good program or not? Is there some sort of seal of approval of some sort of educational council or something?
I wish there was. Obviously, you want to go to a school that has the accreditation so that way you can sit for your boards. But the biggest recommendation that I would say is talk to people who have gone to the school, talk to the teachers at the school, almost interview that school and see what kind of program they offer. How fast paced is it? How many courses or lectures are they requiring you to take each quarter? How long is their externship? I know some of these externships on some of these programs aren't what I went through. Mine was a 10-week, 40-hour per week mandatory externship before I could graduate. And a lot of these schools, they're requiring, the 40 hours, but they're not putting in specifications as to what you need to do in those 40 hours.
Right.
A lot of these kids are getting it done faster than the 10 weeks and just kind of flying through it, getting it done just to get it over with. Where I went, at least when I went, it was very structured. I had a booklet that I had to have signed off, and I had to do X amount of things, X amount of times even. Right. IV catheters, I had to get signed off on 5 different times before that was marked off as completed in my book, as right. well as, bandage changing, x-rays, restraint, mentals, monitoring anesthesia. So there was definitely, I guess, more in-depth in that program. And you can ask your schools that, what are your requirements for graduation? What is your success rate on your students getting hired post-graduation?
Right.
How do you help your students out get jobs if they aren't able to get jobs?
Good. Yeah. Yeah. I got to tell you, there's a part of me that, because I know some veterinarians who had actually been certified veterinary technicians first. So they went through tech school and they worked as a technician, and then they went on to vet school and became veterinarians. And I always envied them, because I think part of the problem is a lot of veterinarians, they have no idea what you guys know and what you don't know. What did you get taught? You know what I mean? Okay. So, not to mention, they obviously have the skills to do, venipuncture and stuff like that, which I did not have when I started at the ER. But yeah, so that's interesting. There's a part of me that wishes that I would have taken that path, because then my knowledge would be more rounded. But I'm glad to hear your experiences and to learn from what you went through. So after you graduated from Bel-Ray, that's when you went to work at Alameda East? Right?
Actually, I was going and working at Alameda East while I was going through tech school. So I was working full time. Once again, glutton for punishment, working full time while going to school full time. So I would go in, 6:00 in the morning, work until 8. I'd be to class by 9. I'd have class from 9 to 5, and then I'd go back to the emergency clinic and work 5 to 10.
Wow.
Yeah.
And this is where they filmed that show. What was it called?
There was Emergency Vets was the original one prior to me. And then the first year I was working there, they actually taped EVET interns.
EVET interns. So if I go back and I watch this series, will I see you?
At that time, I was just a kennel kid. I'm sure if they made a blooper tape, there's tons of me like carrying towels to the hospital and going. I've been told by a couple people that they've seen. At that point, I had an infamous bun that I would wear my hair in, and they'd see that like in the background walking. So towards the end, there was one case that I believe got aired, and it was a chinchilla that crashed that needed to be intubated, and nobody could get it intubated. And so having my exotic knowledge and background, they actually paged me to come in and help. And so, yeah, that was kind of fun and exciting, but that was more so my hands were in the picture, not so much my face. So not necessarily, facial recognition being on there, but I know it, and that's what matters.
I'll have to look for that episode, and then I can be like, those are Danyahl's hands. Okay. And then, then after you graduated, with your vet tech degree, and did you sit for boards in Colorado, or? Yeah, you did.
Yeah, it was easier that way. And at that point, I hadn't quite decided what I was going to do. And I wanted to sit for my boards as soon as possible. And it worked out that my graduation time lined up nicely. 2 weeks after I graduated, I sat for my boards in Colorado.
Nice. Okay.
So everything's still fresh.
Okay. And then what? What did you do after that?
Due to some family things that went on, I actually ended up moving back to Illinois. Did some part-time work at a local shelter, helping with their spay and neuter clinic. And that's where I met a couple technicians that worked at the emergency clinic, and they really liked how I performed there and asked me to come and interview at the emergency clinic. And that was when I got sucked into emergency and fell in love.
Mm-hmm. But you had to take your state boards in Illinois as well, right?
Transfer the score over.
Oh, really? Oh, okay. So there weren't. Okay, yeah, because every state is different for veterinarians in terms of whether you have to take boards in that state. Because in Illinois, all I needed were the national boards, and I didn't have to sit for a state exam. But in Arizona, I had to sit for a state exam. So, yeah, okay, that makes sense.
California, for veterinary technicians, you have to sit for their state board.
Right. Yeah. And in Arizona, reading through the statutes here, I know that technicians also have to sit for their state boards here. Yeah. Interesting. Such a variability in the states.
Exactly.
Okay. And then, so then you started working at the emergency clinic and you fell in love. What did you love about it?
Obviously initially I was petrified out of my mind because it was so fast paced and crazy. But then that's the part that I fell in love with, the ever changing, you never know what's going to walk through the door, and the constant learning. Each night I learned something new, and that really, for me, and how my mind works, kept me going in the profession, because I love learning. I have to keep learning. And when I stop learning is when I typically get bored and move on.
Mm-hmm, mm-hmm. And how long were you working there before I came along?
I started there in 2008.
Oh, okay. So 3 years.
Yeah.
Yeah. Yes, I can do math. Simple math.
I know. It's like, oh my gosh, when did that happen?
Well, I had a pharmacology professor in vet school who gave us some very good advice, which I try to follow, and that is never do math in public. 11 minus 8. 4? All right. So when I came along, I was fresh out of veterinary school, walking into a busy ER clinic. And what was your perception of me when I first started?
When you first started, because you were so fresh out of vet school, like you had all that information just whirling around in your head, and you were so book smart. But you weren't quite street smart yet. Like you had the knowledge in there, and it was just getting it from here to here and like utilizing it. I know for a little bit there, the fast pace of it seemed to be a bit overwhelming for you, but after you picked up on it so quickly,
I did.
You might not have thought so, but you did. You could multitask very well after being there for a short while, but you were very organized and very detail oriented, which I think helped in that ease into doing, ER medicine. You had that checklist, that mental checklist, and you're like, okay, this needs to be done, this needs to be done, this needs to be done. And you could prioritize well. So that also was, I think, helpful for you. But
did you sense my terror or did I hide it well?
Oh no, you could feel it. You could sense it. But at the same rate, I think anyone first starting out in this profession has that sense of overwhelming terror and panic. And as long as you have, one or two people in your corner saying, you can do this, you've got this, like just breathe, it's fine, it'll work out. It makes it a lot easier to get through it.
Yes. And you helped me enormously in terms of like, you get brain to hands kind of thing. And that's so funny because that is exactly the problem, I think, for new veterinarians is it's all in here, but you got no idea how to send it to your hands. And I remember one case, it was a dog that came in with pericardial effusion, which for people listening who don't know, it's when there's a sac around the heart, which is inelastic, so it doesn't stretch, and it can fill up with fluid, and one of those fluids can be blood. And if that happens, because the sac doesn't stretch, the heart inside the sac cannot expand and then pump blood back out. So this is a very dangerous medical condition. And the dog came in, and one of the hallmark signs of pericardial effusion is that you cannot hear the heart when you use your stethoscope to listen for it. And I remember you were standing there with me, and I was trying to listen to the heart, and also the pulses were weak, which is another cardinal sign. And I said to you, I can't hear the heart. I think this dog has pericardial effusion. And you're like, well, then we're going to have to tap his heart. And you just telling you, like, I was frozen. I was like, oh no, wait a minute. I know what this is, but oh my God, now I'm going to have to do something that's really scary. And you really helped me to just do it. So it was, just having you there to be like, yep, that's right. Now we're going to have to do something about it. Ain't nobody else here.
Exactly.
It's you.
It's just us.
Right. So you and I always got along really great, but I did have, especially when I first started out, and I want new, like future veterinarians to be prepared for this, that when you first start out, you're going to be so much in your head, and it's going to be hard working with other people because you're just thinking about the medicine, and you're trying to remember what you learned in school, and you're trying to transfer that knowledge to practical situations. And working with other technicians can be really challenging. And I had, other technicians complain about me that I don't know what they said. I was rude or too bossy, or I showed my frustration, stuff like that. So, did you notice that about me? Did you feel that about me, or did you know that other technicians felt frustrated with me?
I knew that other technicians felt frustrated, but this is where where kind of what we were talking about before, where you have the C's get degrees technicians that just come in, do their job, and leave, and are, not forward thinkers and able to work and problem solve. And then you have your more forward thinking technicians. And I think you really adapted well with the more forward thinking outside of the box, helping you work through things kind of technicians, rather than the technicians that just were waiting for you to tell them what to do. You were more of you should know how to do this. You should know, like, how come you didn't check this temperature when it was, elevated before, and alert me to it,
Yes.
They didn't do it because it wasn't highlighted on the chart, where the more forward thinking tech would go, this cat's temperature is 103.7. I should probably check it in an hour to see if it's changing. And if it's not, I'm going to alert the doctor.
Right. Right.
And that, I think, veterinarians who are good at what they do and love what they do have difficulty working with technicians who don't share that same value and work ethic.
Right, right. And those technicians don't seem to like us very much.
No, they don't. They don't, because you make them work. You make them think. You make them, get outside their comfy little box, and it's uncomfortable for them. Where, technicians like myself, you ask me a question, I'm like, oh, dang, that's a good question. Let's figure this out, and we problem solve together.
Yeah.
And I loved that push, to make myself a better technician. That was for me, it was exciting.
Well, do you have any advice for future veterinarians when they first start out? Because when you first start out, you're so overwhelmed in the first place that it's really hard to tell which technicians are, the hardworking kind who are always trying to think ahead and want to keep learning, versus the C equals degree technicians. And like, how would a new veterinarian tell them apart? Because another problem that I tell you, is trusting the technicians. And I think you know that.
Yep. The biggest way to tell is that technician that comes to you with every TPR that they do, every vital sign that they get, every little thing that the patient does. Don't find that as an annoyance. That's your good technician. That's your technician that's trying to keep you in the loop. They run blood work, and they make sure that it's in your face and you're looking at it. Or if they take a pulse ox and it's not quite right, it might still be within the normal parameters, but they're going to let you know, hey, we're trending downwards, or we're going in a negative direction, or hey, I get the feeling that something's going to happen with this patient. I don't know exactly what's going to happen or when it's going to happen, but can you just look at this pet? Mm-hmm. Those are your good technicians that are always, keeping an eye on their patient, always trying to bring you that knowledge, so you can better treat them as a doctor. The ones that hide in the ICU to themselves and jot down their numbers and take care of their patients, and you don't hardly see them, those tend to be the ones that I watch more closely, because they're not relaying that information to you. They're not keeping you in the loop. And for me, they're not always, but tend to be the less forward-thinking ones, and the ones that will leave a hyperthermic animal hyperthermic until the next TPR because it's not highlighted to check it. So why should I check it?
Right, right. Okay, that's great advice. And I think, I didn't even know that this was something that I should be paying attention to or observing. In veterinary school, of course, all the technicians were very skilled and educated, and I sort of took for granted that when I went out into the real world, everybody would be like that, but they weren't. So it's really important for future veterinarians to be prepared that when you first start, even though you're going to have a head full of knowledge and you're going to be overwhelmed intellectually, it's really important to observe the people that you're working with to try to figure out, okay, which are the ones that I'm really going to be able to work closely with and depend on versus which are the ones that I'm going to have to watch.
Yeah. Yeah, and also with that being said too, the technicians that ask you questions is not necessarily to undermine your way of thinking. It's purely because they want to learn. If they ask you, well, this animal is doing this and we haven't done this, is there a reason why? It's not necessarily that they're questioning your knowledge base, but they're just trying to learn themselves as to, why you're doing things the way you're doing it. Because a lot of technicians do more so a pattern recognition, particular doctors with particular cases will do particular things, and they start to learn your routine. When doctor goes into surgery, what size gloves, what instruments do they use? And by them asking questions, it's them learning, how you like to do things. Not as much questioning why you're doing things.
Right, right. And I'm so glad you brought that up, because especially when you're a brand new veterinarian, you feel so insecure about your knowledge and your abilities that if somebody asks, why are you doing this or why aren't you doing that, it's really easy to take it as them challenging your medical judgment. And so that's... but sometimes they are, there are technicians out there who think that they know more than the doctors do. And so that's the other side of the coin. So it's kind of a sticky situation, really.
Yeah, agreed.
Yeah. But I do think that's really important. And, Alex, my husband, who's an MD and works in a hospital, he tells me about nurses questioning him. And it's just really interesting because the culture at that hospital and in most human hospitals is that the nurses are encouraged to question the doctors. And they do question sometimes because they're curious and they want to learn and they're trying to figure out how this doctor works. But sometimes they're questioning because they disagree with what the doctor's doing. And now that can be very threatening, especially for a new veterinarian. But at the same time, I have had technicians point out, that I miscalculated a dose on somebody. And so they saved me from actually making a mistake. So do you have any advice for how a new veterinarian might balance these two different things? Like on the one hand, you feel threatened and because you feel so insecure and because you're brand new, but on the other hand, you really should, consider that maybe they're trying to learn, or consider that maybe they're right. Maybe, you need to listen because you're about to make a medical error.
For each person, I think it's going to be different for them and how they deal with those kind of situations. The biggest thing is listen and, explain yourself. If there's a reason behind, why your technician comes up to you and says, typically this is a, once a day drug and you're having it given twice a day, are you sure about that? Give them your logic, listen to their logic, and come to a mutual agreement.
Yeah.
And a lot of
sorry, go ahead.
Go ahead.
That example is perfect because when I was really new working in the ER, I remember this cat came in, and this cat was septic. He was in trouble, and It was very busy. It was crazy that night. There was just like, just one after another coming in through the door. Plus the ICU was full with sick patients. And this cat, I just like, okay, he needs to be on fluids and antibiotics. And I put him on Baytril IV BID twice a day. And you weren't there that night. I think if you were there, you probably would have said something to me, because you don't do this in cats. And I think that the other technicians that were working that night, I was used to just doing that for, that's what I did for dogs. And there were so many other things going on that I didn't stop to think, and I made a mistake. And none of the technicians said anything to me, even though I know they knew. None of the other doctors put cats on Baytril twice a day, especially at this high dose. So nobody said anything to me, and the cat ended up having seizures until one of the other doctors figured out that he was being overdosed on Baytril. Luckily, there were no long-term negative effects, but he could have lost his eyesight permanently from that. So, and nobody said anything to me, probably because, I don't know, they were scared of saying anything to me, maybe.
I vaguely remember hearing about that. I think I was on vacation when that happened, and I came back and they're like, "Oh my God, did you hear?" And I'm like, "Nope, haven't been here." What happened? So
yep.
Things like that,
So I think part of the problem was, because I was so insecure and I was trying to project that I was confident. Also, I was in a bloody hurry. I probably barked the orders out, and the other technicians were probably like, okay. So new veterinarians, you have to be really careful, even if you're really busy, even if you feel insecure, to try not to project the persona that scares other people and prevents them from saying something to you that might actually prevent you from making a mistake, because everybody makes mistakes.
Yep. It happens. You just have to learn from them, and you will never do it again.
Not that one. I'll make different mistakes. Not that one again. Yeah. So that's really helpful. If only we could go back and do it all over, knowing what we know now. So, all right. And then I moved on after about 2.5 years at the ER. I got tired of doing night shifts, and I went to day practice, and then you eventually went to day practice too, right? Because the night shift was hard on you as well.
The night shift was hard on me, but I was also, again, glutton for punishment. While I was working at the emergency clinic full-time, I was working part-time at a day practice, trying to make, ends meet and make money so I could pay my bills and what have you. It wasn't until that veterinary owner retired and sold the practice that I eventually realized something needed to change, and I needed to be able to afford to live and not work 3 million jobs. And I found a job working at an animal sanctuary. I did that for a couple years, and then now I'm back at a day practice again. So.
Right. Okay. And the animal sanctuary paid well.
Mm-hmm.
Yeah.
The hours, and so.
Right. Now, if I remember correctly, one of your concerns with working those overnights is, and as well as working multiple jobs, was your health, right?
Yeah. I was having a hard time sleeping. I was having a hard time with my weight. My blood work was trending in the direction of diabetes. Mm-hmm. I was diagnosed with hypothyroidism. So my health was kind of spiraling massively downwards, and I needed a change.
Yeah. You and I both had had similar issues. I mean, I ended up pre-diabetic as well. You and I were both much heavier when we were working together those overnights. You look great now, and
So do you.
Thank you. Now that we're living, a normal schedule that human beings are supposed to live, we're healthier. Yeah. And so now in the day practice, where you're at now, I want to ask a little bit more about this, because one of the reasons you were working so many jobs to make ends meet is because you had those huge student loans hanging over your head. And if you hadn't had the additional $80,000 in student loans, if you just had the loans from tech school, I think you would have been in a much better situation financially.
Most definitely. Most definitely. I mean, I have just about paid off tech school. I only have a couple $1,000s left of that.
Congratulations. That's great.
But I still have that ever looming balance from undergraduate still there. I mean, it's getting down. It's about half what it used to be, but
that's great. That is great.
A large chunk of money that I have to pay. So
yeah, but at least you've actually made a dent in it. And, because there are some people who have such a hard time with their loans that they may be making, the maximum payment that they can afford every month, but they're only paying interest. And so they never start touching the principal, and the overall amount never goes down. So you've actually managed to get into the principal, and now you're able to actually really chip away at that debt. So I'm happy for you. Good job. Do you have a
budget?
Yeah, balanced budget. Do you have a plan for like when you're expecting to pay it off completely?
All of my student loans, I mean, I have a personal goal to get it paid off by the time I'm 40. But right now, my projected time frame is probably another like 12 to 15 years on the big loan, because it was a 30-year loan.
Yeah.
So
do you try to make payments that are over what the minimum?
Yeah. So what I did when I got out of school, I actually had loans with 3 different places. And so what I did, plus credit cards, because, you gotta live. So what I did is I took and paid the minimums on all of them except for my smallest one. And I paid as much as I could on that small one until it got eliminated. And then I took what I was paying into that small one and added it into my next, largest one, and so on and so forth. And I've dwindled it down to just 2 loans now, and only 1 credit card. And so I've just been working hard and still piling almost $1,000 a month, into my debt. And hopefully eventually one day that'll just get to go in my savings account. But
Right. That's a lot of money, $1,000 a month. And so, and I wanted to talk a little bit about, so people could get an idea of, if they think maybe they want to become a veterinary technician, and whether or not you can make a good living as a veterinary technician based on the wages that are paid versus the amount of student loan. Because, people are starting to, I think twice about going to vet school because of the cost, and you end up coming out of school and it is literally crippling. And so it seems like if you wanted to go to veterinary tech school instead and graduate with, say, $20,000 to $30,000 in student loan debt, and then what are the typical wages that a licensed veterinarian can expect to earn?
Starting out typically is around $15 an hour. As you gain experience, you can make upwards to, $20, $22 an hour, especially if you do overnights, work at a specialty clinic. most of your day practices, though, although some of them still are only paying their technicians, $11, $12 an hour, which is mind-boggling to me. How there's no way you can survive off of that.
No.
That's why, when I first came out of school, only making, that small amount of money, I was working multiple jobs in order to make ends meet, because it wasn't enough. The other thing, advocate for yourself, know your worth, ask for what you're worth. Any technician graduating from school, as long as you've put in the effort, gotten the good grades, worked hard for it, and are confident with your abilities, it shouldn't be difficult to ask for that $15 an hour base pay, which still is
the minimum.
Is not a lot to live off of.
Right.
When you still have to pay rent and all your other bills on top of car insurance and school bills and eat, but fight for what you're worth. Make sure that job offers health insurance, offers retirement plans, offers scrub allowances, especially if they require you to wear a certain color uniform. Those are all things that you want to look for in a job, in a good job.
Yeah. So this is, and this takes us back to the two different kinds of categories of veterinary technicians, the C equals degree kind versus your kind. I think somebody with your mindset, who's always wanting to get better, who is dedicated to doing the best job she can, and is always learning and improving, that's the kind of technician that will be eligible to work at those places that are paying $20, $22 an hour, right? And so if you finish vet tech school with $25,000 in student loan and you're making $22 an hour, that's not bad, But you have to be of the mindset where you consider you act like a professional, you consider yourself a professional, and you're always working on your increasing your professional skills and value, right?
Yep.
Yeah.
Agreed.
Yeah, because I think there's a lot of technicians who are working for lower wages, and they get frustrated, and I don't blame them, because it is impossible to live on that much money. So the alternative to that attitude is make yourself more valuable, right?
Yep. Make yourself more valuable, invest in yourself, continue your education, prove to your employers your value, and, ask for it. A lot of people are afraid to ask for that raise. They might have started out as an assistant making that $10, $11 an hour, and then they go to vet tech school, they get that degree, they get that certification, they put all this work into it, and then they forget to ask their current employers for a raise.
Oh dear.
Yeah. Don't forget to ask that. You've invested in yourself. You have tried to better yourself for their business. Ask them for that raise. Ask them for that competitive pay. And if they're not willing to offer it, there are clinics that are.
Mm-hmm. Yeah.
And just start looking.
Yeah, it's very important. Yeah. And I've worked at a lot of different animal hospitals, and there's been a great variability in the skill level of the technicians that I've worked with. Of course, when I was in the ER, shoot, I was spoiled. And then in the real world, there's some technicians who can't even do a blood draw, stuff like that, So if there are technicians out there who are good at what they do, it makes me sad to think that they would end up being underpaid. And because there are clinics that will do that, but those aren't the clinics that you want to work at. Whether you're a doctor or a technician, you really want to work at a clinic that's willing to invest in their employees. Those are the clinics that will attract the best employees. Those are the clinics that want to keep the best employees, right? They pay them fairly, they treat them fairly, and in return, they expect conscientious, hardworking, always learning, always improving kind of attitude.
Yep.
Yeah, that's the ideal. So tell me about now you're working in a day practice, and it seems like your life has improved drastically since, you stopped working overnights and you're in day practice, and you've actually met somebody. When we were working together in the ER, you were single and you didn't really have time to look for Mr. Right, but
no, and working overnights, you don't have a social life. You're sleeping when everyone's awake and awake when everyone's asleep. And it was rather challenging to find someone who would even work with my crazy work schedule. And so that was the other thing. When I switched to working days at the animal sanctuary, I was able to get out more, socialize more, and ultimately ended up meeting my boyfriend now. And if you would have asked me a year and a half ago where I would see myself, definitely would not have predicted this at all. Being happy, smiling more, working at a place of, I would have never foreseen that. I would have been the more, doom and gloom. I'm stuck in this rut and I can't get out.
Mm-hmm. We'd probably both be diabetics by now.
Oh, yeah. And probably about 300 pounds each.
Yes, it's true. It's true. Yeah. I'm so happy for you. Last time we were talking, you mentioned that you, at the day practice where you're working now, you've gotten them to embrace fear-free philosophy. I'm not that familiar with it, but could you explain a little bit of what fear-free is, and what do you do in order to become fear-free certified?
So, one thing that drew me to this practice actually was they wanted to become fear-free and had been discussing it. And I have always, without even realizing it, had been practicing a fear-free kind of medicine. And it's, a lot of people are like, oh, that won't work in a practice. You have to get the job done. You're only allowed at a certain amount of time in this appointment. But what you don't realize is when you rush, when you push the patient to its limits, it only makes your next appointment with that patient harder. And if you would just take that 5 minutes, step back, evaluate how your patient is responding to you, give them a second to realize what you're asking of them, and try to work together, you'll find that your future appointments with them, because that appointment wasn't so scary, gets better and better and better. Rather than spiraling downwards, you spiral in a positive direction. And so this clinic actually went through and paid for all of their technicians and doctors to become fear-free certified and go through fearfree.com certification program, which I thought was amazing.
That is great.
There are very few clinics that are this forward-thinking and compassionate and caring about their patients, which is another reason why I wanted so much to become a part of this business, because they are that way. So it was quite fun. Certain things on the certification program, I'm like, yeah, I do that. And then there were other things like, oh, I didn't know about that, pheromones and those kind of things, so I learned as well, which was amazing. But, a lot of it, is just taking that time, looking at things from the animal's perspective. If you had some stranger or strangers come up to you and pin you down on the floor and grab your feet and try poking you with needles and taking this object that clicks and trying to cut off your fingers, because that's all they think, you would be panic stricken, peeing yourself and biting too.
Oh, for sure.
And so if you just step back and go, okay, if this were me, how would I want this done? and try that approach, you'll find that a lot of animals are more receptive and a lot calmer. The other thing is take a breath. If you're getting frustrated, take a deep breath, step back, reevaluate the situation. And sometimes you have to step away and have someone else come in. And it's not that you couldn't do the job. It's just that you and that animal were not a good fit together, energy-wise, personality-wise,
mood-wise.
Mood-wise. I mean, animals are so receptive to how you're feeling. If you're having a bad day, you're going to have a lot of difficult patience because they're picking up on your bad mood. That's
so true. Absolutely.
So it's just, fear-free is one of those things where, like I said, it's just, taking a step back, looking at it from an animal's point of view and trying to work them through their scary moments. They're not necessarily being aggressive. They're just fearful and not understanding of what you're asking of them.
Mm-hmm. And yet you're still taking precautions to make sure that the staff is protected and they're safe.
Exactly. We do a lot more muzzle training with the ones that, you kind of can read them that they might not mean to bite, but they will bite you. And so we'll take, treats and set them on the muzzle, have them eat treats on the muzzle, and then set the treats in the muzzle and have them stick their nose in the muzzle to eat it. And then once they're eating treats in the muzzle, then we put the muzzle strap around and strap them in and keep continuing to give them treats through the muzzle. So they realize that, wow, this thing on my face, though uncomfortable it might be, it gives me cookies.
Right. And so, because I'm definitely one of those people who's a little bit dubious about the whole fear-free philosophy because, I've worked in practices where you've got 15-minute appointments and whether they're sick or well or whatever, and sometimes people bring in all three of their pets instead of just one, and then they're double booking, and then there's walk-ins, So under those circumstances, I don't think that a fear-free philosophy would work. But the place where you're working now, they're 30-minute appointments, and do you agree? Do you think fear-free would work at like one of those crazy clinics like I'm describing?
No, anything where your appointment is only a 15-minute window, like there's not enough time to work the animal through their fears and apprehensions and educate the client and appropriately care for your pet. Those are more of your car wash clinics where you come in, you get done, and you get out. They're not going to take the time to, spend with your pet and make them part of their family as much as they are part of yours.
Right. So important. I think a lot of people don't even realize how much of a difference there can be between different animal hospitals. Yeah. And just a little background between Danyahl and me. And in addition to working at the ER together overnights, Danyahl is now working at the last practice where I worked before I moved to Flagstaff, which was the best practice I've ever worked at. And I loved it so much there. And I'm so happy to know that you're happy there as well. Yeah. Really great place. That's the kind of practice that I went through so many different animal hospitals. I did about a year of working just relief because I was looking for a good practice, and it took me that long to find the place where you're at now. It's a kind of practice that, it's reasonable appointment times, and the owner and the office manager are genuinely concerned with always making the practice better and better. Yeah. And taking care of their people, and
as well as the animals in the clinic. I mean, they are quite possibly some of the most amazing people I have ever worked for, and I've been through a lot of clinics as well. And like any place, there's always room for improvement and change, but the thing that makes them so much above all the other places is they're willing to listen. They're willing to hear you out. They're willing to talk things through and figure out a happy medium between not only their employees, but their clients. Not everyone can afford that top-notch surgery or going to the emergency clinic, but they're willing to find that happy medium where the animal's getting the care that it needs for a cost that the owner can work with.
Yeah, it's sort of the attitude that the owner can't afford to do what the gold standard, but we can try. It might not work because it isn't everything that we're supposed to do, but we can try. Yeah. I love that place. I've been very reluctant to even look into working here because I don't want to go through the same process that I did before I found that place, because hospitals like that are indeed few and far between. And actually, for the listeners out there, it's kind of funny because every podcast so far I've mentioned, working at the worst hospital on planet Earth, and Danyahl knows the one that I'm talking about because she interviewed there, and she called me and told me that she interviewed there, and I was like, no, just no. And then, and I knew that the good place was always looking for good people, so got you out of that. You didn't have to go through what I went through.
Yeah, I think I would have stayed unemployed and not worked at that place. And just chewed through some more of my savings account until I found a place that would have worked for me. Because that place was, for veterinarians out there and for technicians out there, if you walk into a clinic and something in the pit of your stomach says run, listen, you're not going to make the practice better. There's no changing them. That's what they do. That's what they've always done. And it's not for you.
Very important. Absolutely. Yeah. Tell me about your perception when you walked in there.
Oh my God. So it was like the interview process was fine, the verbal part. And then they asked me to shadow for a couple hours. And, when you're going into an interview, you're in dress outfit, dress shoes, hair done, makeup done, because you want to look professional. And so I, after going through other interviews, thought, okay, well, shadowing means I follow the head technician and just kind of get an overall perspective of the hospital. Little did I know that I was going to be following one of their surgery technicians who was in a procedure on a dog. And yeah, they stuck me in their surgery suite. No hairnet, no face mask. I quickly pulled my hair up with the hair tie that I had around my wrist. And the technician was sitting there, standing there monitoring the patient. And it looked to be that the surgery was done. There was no doctor in sight. And I had asked the technician, I was like, oh, so are you guys done? And she followed the statement with, no, we still have some more masses to remove. The doctor had to go see appointments. And I was like, is that normal? And she said, yes. I was like, okay. Right. And I looked at her anesthesia chart, and this dog had already been out for a significant amount of time and was on minimal monitoring equipment, which I did not like. And so my gut instinct, of course, went to this dog's pedal pulse, because he was also an 11 or 12-year-old boxer, getting multiple mass removals. And as pedal
pulse, just for those listening, is the pulse that you can feel in their foot.
Yeah, well, as long as their blood pressure is good.
Yes, well, that's why you were checking it.
Yeah, so I nonchalantly just kept my hand on his pedal pulse, because if you can feel that, obviously his blood pressure is fine. You can get his heart rate. You don't need the equipment necessarily, but you need to be checking those things. And a good half an hour went by or more before the doctor showed up, and he walked in blue jeans and a t-shirt and gloved up, didn't scrub, picked up scissors and did not re-scrub the mask, but just cut it off. I was like, oh, okay.
Were these scissors out of a fresh surgery pack?
No, they had been sitting out for a while.
Right.
And so I was like, okay. And then this technician kept on praising herself on that she convinced the owners to do gingival resection, because boxers are known for having hyperplasia in their gums, and they cover their teeth and can cause issues. But at that age, it wouldn't be my top priority thing to do on a boxer. I mean, as long as he was doing well otherwise. And the doctor just grabbed a couple blades out of cold sterile and just started cutting away at the gums. And the pulse ox probe fell off, which reads the oxygen concentration in the body, as well as it measures the patient's heart rate, which are quite vital in anesthesia. You want to make sure that they're, handling things well. And he asked the technician, well, it's been fine so far, right? And she replied, yes. And he goes, okay, well, then you can leave it off. And instantly I went into my, that's not going to work mode. And I was like, well, you could attach it to the ear or the inguinal area or between the paws or the prepuce, and listed off like several different areas where you could attach it that you'd still get a reading and not have to worry about it falling off the tongue or the lip, where we commonly put it in surgical patients. The technician went, oh, really?
Yeah.
Yes. And at that point, I knew that this was not going to be a good fit for me. It was further enforced when one of the vets there proudly showed me some x-rays on a husky and asked me, what I thought was wrong. And I pointed out the linear foreign body that was most likely a sock and the small intestines. And the doctor was like, dang, how'd you see that?
Are you saying the doctor didn't see it?
Correct. Yeah, they sent it to a specialist for an ultrasound and they found it.
Yeah. Well, and you know what? This practice went through so many doctors. I wouldn't be surprised if that was like a brand new grad who'd been practicing for 1 month,
Yeah. So, yeah.
Yep. And the mistake I made is I went in there and I was told by the owner veterinarian, about all of the great things that were going to be changing. Right?
Yep.
But don't believe it, because places like that do not change. If they're going to be good, they're already good.
Yeah. When you're interviewing at places, as much as they ask you for references, ask them for references. Ask them for, veterinarians and technicians, past, present, that have worked there, and sit down and call these people, because, I walked out of that place going, oh my God, oh my God, oh my God. And knowing that, Dr. Kung had worked there, I was like, I am texting her right away. Like, what happened when she was there? To get another person's perspective. Because, sometimes, you see things in a different way and are too picky. But obviously, that was not the case in this particular situation, because you were like, no.
Oh God, no. Yeah. And it's, and when you're looking for a job, it's because you need a job. And I think that we have a tendency to see things in a nicer light than they actually are, because we need a job and we want a job, but it's just not worth ending up in a place that is going to make you miserable. So I would say live in your parents' basement and just keep looking if you have to. Yeah, because places like that can really mess you up emotionally.
Do relief work.
Yes. Well,
clinic, tell them, well, I'm looking, can I do some relief work here, work a couple shifts there, see what they're really like, and then make your decision. It's out there for both technicians and veterinarians to pick up shifts at different clinics, and that's kind of a good way to feel them out and figure out which one is a good fit for you. Right.
It's harder for new veterinarians to do relief work because they're so inexperienced, and then, going from one hospital to another can be super, super challenging. But hospitals that are looking to hire new veterinarians, I think many of them would be completely happy with the suggestion of, why don't I work for a week and see how we do,
Yeah.
Because, oh boy, not worth ending up in a terrible practice. Okay, I think we're about ready to wrap up. Thank you so much for all of your time and helping me to give information to people who want to go into this field that hopefully will save them from making some of the mistakes that we've made, or save them from suffering some of the emotional distress that we suffered, or physical. Yeah. But so let me ask you this. Do you have any, what was your biggest surprise when you started working in the field of veterinary medicine? What surprised you most?
I think the thing that surprised me most and probably stopped me from returning even after I finished my veterinary technician degree, of going back to, veterinary school. You're going to find a huge lack of appreciation for what you do. You're going to find those clients that just hate you. They tell you you're killing their animal and you don't care and you're all about the money. And those are tough days, and you'll get multiple ones of those in a row. And, with the amount of debt that you come out with and the sheer lack of appreciation, I think that's what stopped me from going back to vet school, because I just don't know that I personally am strong enough to deal with that day in and day out. And to all the veterinarians that I have worked with and will work with in the future, I have a great respect and profound appreciation for the dedication that you put into this profession. And without you guys, I wouldn't have a job. But it's unbelievable what you guys put yourself through, and know that there are people out there that understand that, you're having a tough day, or there is a tough day, and talk to them about it. Don't bottle it up. Don't keep it inside. Don't think that you're the only one feeling this way, because you're not. And talk, lots and lots of talking. And always remember to breathe. That's my biggest thing throughout my entire career. Take that. It's my 2-second rule. It takes 2 seconds to take a deep breath in, a deep breath out, and refocus.
Mm-hmm. And when I was a new veterinarian, I would forget to breathe, and you helped me so much. I'm just so grateful that you were there, when I was first starting my career, because you helped to remind me in very stressful, scary moments to calm down and breathe.
Yep. It doesn't help anyone to get upset, worked up, or frustrated. It only clouds your judgment, and that's where mistakes kick in. So you can take a step back, regroup, refocus, and it all works out.
For sure. Thank you so much, Danyahl, for all of your time and advice. And it was really great catching up with you. I really appreciate it.
Yes. You're welcome, and thank you.